Hi, Dr. David Schiller here, and today we're going to talk about how your blood work is being evaluated. And the reason why you get your blood work done for your thyroid condition or any other condition for that matter, and you're being told everything's okay, is because they're evaluating it according to what the lab is telling them. So I want to just let you know that there are different ranges that can be used to determine how you're doing. And a lab range, which is typically the range that you see on your lab, coming from whatever lab you're going to, is a range that is derived from the average, meaning all the people that go through that lab in whatever amount of time they determine, they're statistically analyzed, and it's determined that the range should be a certain amount. So this lab range between two numbers is just telling us what the average is. It's basically a bell curve of the average person going through that lab. Now, if you think about it, who is going through a lab typically? A lot of people are getting checked that are not doing well. They're ill, they have an illness, they have symptoms, they have diseases. So therefore, you can have people with high blood sugar and low blood sugar, high thyroid and low thyroid, high cholesterol or low cholesterol. In other words, you're getting people that have numbers that are so broad in range that everybody's going to look normal. So basically, everybody looks normal is because you're being compared to the average that's going through. Now, what we use in our office, because we practice what is called functional medicine, and we'll get into another edition of a video edition to tell you what functional medicine is, but basically in functional medicine, we're trying to evaluate the entire physiology of the body and look at what is the relationship between all the different systems of the body and how we can approach the person from a holistic perspective, taking a step back and looking at them in that way. When we look at you from that perspective, we use what are called functional ranges. And a functional range can be a lot narrower, and it's based upon not averages, but what has been considered optimal. And there's different associations, and they use different ranges. But typically, we're going to be looking at a range that's much narrower, and therefore we can pick up problems way before a typical doctor can. So a functional range, and we can give you some examples. Let's talk about thyroid functional ranges, because that's what a lot of you are watching this for. In that we're looking at TSH, for example. And TSH, you look at any lab, you'll typically get a number between 0.5 and 4.5. And it might be above or below this or above and below that. I'm just giving you, for example, and this is kind of what I see most of the time. What has been determined to be a functional range for TSH, thyroid stimulating hormone, the hormone that comes from your pituitary gland that tells your thyroid what to do, we use numbers in the range of 1.8 to 3.0. So you can see it's a much narrower range, and therefore, if you're lying in here, you're going to be told that you're okay. If you're lying in here, you're going to be told that you're okay. We're going to see if you're lying within this range. Not until you are out here or up over here will the mainstream medical field really say to you, you have a problem. So the idea is there's such a thing as a functional range, and if you're not using that to determine how well you're doing, then you are being evaluated in not a complete way. You could use other examples like blood sugar. Blood sugar typically on a lab, the lab range is between 65 and 99. Sometimes you see 65 to 110. But the idea is, in this functional range, we want to see it between 85 and 99. And if you're below or above this range, you're either hypo or lower blood sugar, or hyper or insulin resistant or pre-diabetic. Right? So the idea is there's different ranges to look at, and if you're not looking at these functional ranges, then you're going to get a very limited viewpoint of what's going on with your picture. So I'd like to thank you for watching, and make it a great day, and I'll see you soon.